A revision knee replacement is a complex procedure. It's not an operation that we do as frequently as a knee replacement. The knee replacement is taken out and then a new one is put into place, preserving all the soft tissues around the knee replacement. And hence, it's an operation that we take very seriously, do infrequently, and we try and get the best function possible of the knee that's not working. A revision knee replacement is usually required, and there are some common reasons why it is required. Perhaps the most important thing the first time is that the operation itself was not done properly the first time around, and this can be from various reasons, and therefore the patient's unhappy with it, and therefore we have to consider the possibility of a knee replacement. The other reasons, which are, I wouldn't say common, but uncommon, they include the possibility of infection, which is quite rare, the possibility of instability, sometimes persistent pain, sometimes lack of mobility, and very often what we find is that patients who have had operations done after a knee replacement who are unhappy with it, we usually wait for a period of time, and if they're still unhappy, we try and investigate the cause and consider for a knee replacement, a revision knee replacement. The risk of revision knee replacement is important to consider before considering any form of surgery, because not only do we have to work with a patient who is compromised after having a knee replacement, but also the risks involved with the surgery itself. The risks which we need to consider as far as the patient's concerned include the general risks, which might have been mentioned at the time of the primary surgery. This includes rare possibility infection, stiffness, even after the second operation, possibility of DVT, pulmonary embolism, bleeding, and of course, stiffness, and the rare possibility of damaging nerves and arteries. The specific risk to the operation itself includes the possibility of loss of bone that happens during the operation, inability to get a very successful revision knee replacement into place, the possibility of the operation itself becoming more complicated because of things that we find during the operation. And of course, in the rare instance, if we find that there's infection in the knee, then the operation might have to be as a two-stage procedure rather than a one-stage procedure. So I think it's important to consider all these and discuss it before one considers revision knee replacements, as it's not a straightforward undertaking, as it has a slightly higher risk of risk as well as complications. That's an interesting question, because the knee replacement itself is an operation that's done when the knee is so painful or should be done when it's so painful that the person is not unable to tolerate it anymore. So we try and delay the operation as long as possible and use various non-surgical means to do so. The younger the patient, then the higher and the more active the patient, the higher the chance of us having to do revision knee replacement surgery. Generally, in a lifetime of one's individual, and overall of course of us are actually living longer, the earlier the operation is done, the need for a redo surgery increases. One can do one revision knee replacement without too much difficulty, but once one gets into the second and the third revision knee replacements, the chance of success start coming down and chance of complications go up. So generally in one person's lifetime, we would like to do ideally no revision knee replacement or just one revision knee replacement if possible in a person's lifetime. The revision knee replacement surgery currently is a very high standard, and the first operation, if unfortunately it doesn't work, redo surgery is very effective in restoring the bulk of the function of the knee. But one has to remember that the first operation is always the best operation, and therefore have your knee replacement done by somebody who does a lot of them and does them well. As far as revisions are concerned, a lot depends on how the operation goes. If the operation goes successfully, one can expect a considerably good deal of function and good quality of life after the revision knee replacements for anything up to 10 years. We haven't been doing revision knee replacements for more than 20, 25 years, so that data is not available. And hence, success, I think, is something that's measured by the patient. And if you're able to correct all the problems that was there in the first knee replacement, in the revision knee, the operation will be considered as successful by the patient. In general terms, the revision knee replacements tend to have poorer function than the first time round, and generally have a lesser life than the first time round. And one doesn't want to go back in once again if one can help it.